It was the first community health center in the state of Wisconsin back in 1969. Now, with 7 clinics and more than 40,000 patients, 16th Street Community Health Centers is a force for good. It provides dental, physical, and behavioral health services in accessible community locations with a focus on narrowing health disparities and access gaps influenced by cultural, language, and economic barriers. Joining us to help us learn more about 16th Street Health Centers is Ahmad Qawi, Vice President of Advancement for 16th Street Community Health Centers. Thank you so much for being with us.
Thank you much. How you doing, Denise?
I'm well, thank you. Who does 16th Street Community Health Centers serve? Are there specific areas of the city and certain populations where its work is focused?
Yeah, 16th Street, like many other of the federally qualified health centers, we have our own area, and we're the south side of Milwaukee. And so I would say we're south of 94 all the way to the lake, and we actually also service Waukesha County also.
So it's a wide variety of places you serve.
It's a very, very wide area.
So do you provide really a ton of different services at the locations? You offer everything from dental care, physical health, mental health services, behavioral health. Why was it important for the organization to offer all of those services?
And talking with, our CEO, Dr. Schuler, about the history of the organization, it's very important that when you're working in communities, low income, transportation is an issue, to have people go to multiple locations is burdening. Is very burdening. And so the philosophy for us is we're not going to say we're a one-stop shop, right? But we really want to be the location where they can come and they can be here for an exam, but maybe our provider has identified something else that's happening. And it's nice to have that service in-house that either we could just refer them to, but not make it so burdensome for members of our community to just be having to go from one side of town to the other, to downtown, wherever. We really want it to be a place where, as much as possible, we can be the location where they can get as much of the services they need in one building.
You really service the whole person.
That is definitely our goal. Is we not only service the whole person, but we service the whole family. From perinatal to our elders. We really believe that in order to have a healthy community, you have to service the whole family, and not just in medical. Like you said, we have medical, behavioral health, mental health, dental, community. And so we are really trying to service not only just the person, the entire person as best as we can, but the entire family.
One thing you also do is you have clinics in schools in Milwaukee to be able to service young people. How did that come about, and what kind of services can young people get?
Yeah, it's very important that, think about, all of us who are parents, and you get that phone call and, you're at work and your child is not feeling well. Guess what you have to do, right? You have to take off from work. You have to go pick up your child. And having clinics in the schools, we're in 23 schools on the south side of Milwaukee. I think one is being South Division High School. But being in those schools, think about when that child is not feeling well. And some of the schools have nurses also. So every school is different, meaning that the hours and the dates and times are not universal. But based on the school, that child can go to one of our medical clinics to see a provider, to see a nurse, and that may prevent the parent or guardian from having to take off time from work, and really be able to keep that child in school, if possible, keep that child in school and provide them full medical services while they're in the school. And the parent does not have to take off work and make an appointment or urgent care. It happens right within the school. And that's a major benefit for for us as an organization.
You also offer, and you alluded to this a little bit in one of your answers, you also offer educational programs for families, for individuals. What are some of those programs and what are they designed to do?
Well, we have, I call it the strong, I call it the strong initiative. Okay, we have Strong Start for Kids. Under that bucket, we have early childhood and healthy brain function programming, maternal and perinatal healthcare programming, family planning, abuse prevention, right? So that falls under the Strong Start for Kids category. Then we have Strong Communities. Strong Communities is really, really about making sure that, and the reason why FQHCs were created was to make sure that we do not turn anybody away. And so we have sliding fee scales. We have, we service the uninsured, to the fully insured. And so, and even within that, it's very important that when our providers, our navigators, our nurses, and medical assistants, when they're talking to our patients, they dig a little bit deeper to find out what that person may be going through, right? And if there is a program that we have in-house, then we will refer them to that program. Okay, so it's very important that we really dig deeper into the patient to see how we can provide them with overall care. And then the last one is Strong Minds. How many times have you been into the doctor and they say, have you been depressed, right? Most people may say no, but if you say yes to us, guess what? We have a very big behavioral health, mental health department. And so again, that's an in-house referral service that we can do to, again, address the entire program, the entire person.
There is a lot going on at 16th Street Community Health Centers. Thank you so much for joining us today, Ahmad.
I appreciate it.
For more information, you can visit the 16th Street Community Health Centers at sschc.org. We'll be right back.